Hello everyone. Sports are no longer a recreational activity. Many people are taking sports as a professional. The sports has numerous benefits. So we should look at it what we can do to prevent sports injuries like knee injury, shoulder injury, ankle injury, wrist injuries which are common nowadays. Of these injuries, the knee is most commonly involved. So let's understand why knee is more prone for injury. Our knee has a thigh bone, a leg bone, which are covered with the smooth surface we call cartilage. Our knee is supported by the four ligaments. The two side ligaments we call as an MCL or medial collateral ligament, lateral collateral ligament, the front ligament which is called the anterior cruciate or ACL, or the back ligament called the posterior cruciate ligament. Now let's understand why these ligaments are important. Take an example of the hip joint. The hip joint is a stable joint. It is like a ball in a cup. Our hip joint is surrounded by a bony bridge which makes the joint stable, so it is not getting dislocated early. But in the knee, our both bones are being held by these ligaments and the cushion called meniscus. So whenever there is an injury, these ligaments are under strain and the knee is more prone for injury. So now let's talk about why these knee ligaments get injured. So our knee ligaments are strong enough to carry out day-to-day activity like walking, jogging, running. But any twisting injury, say while running, playing, or abnormal twisting of the knee can injure these ligaments and the meniscus. See, of these ligaments, the ACL or the anterior cruciate is most common ligament that gets injured in the knee, followed by the side ligaments, what we call the medial collateral or the lateral collateral ligament, and followed by the posterior or the back one, which is the strongest of all. This is a very common query whether these ligaments will heal by themselves or we have to operate. So let me make it simple. Our knee has four pillars or four ligaments, two on the sides we call medial collateral and lateral collateral ligaments. Actually they are covered with the muscles and our tissues, and it has a lot of blood and it has power to heal by themselves. The posterior cruciate ligament, which is at the back, it partly covers and it has partly regeneration capacity. But unfortunately, our anterior or the front ligament, we call it ACL or anterior cruciate ligament, it is inside the joint. It doesn't have any blood supply. It doesn't have any power of regeneration. So if it is broken, it is not going to heal by itself. If in some injuries the knee ligament is partly injured, so unfortunately the knee ligament will not going to regenerate and your knee is going to be with that partial ligament. When a patient comes with the knee injury, the priority is to give rest to the part and get the movement. So we wait for a week or two, analgesics with splint so that the patient gets reasonable range of movement. Then we ask for an MRI to assess the ligament injuries. So if an MRI reveals a meniscal injury, if a small meniscal injury will be taken care by a small pinhole surgery, what we call arthroscope, where you put the camera inside. If it's a small bits and pieces, you nibble it or you just stitch it, and patient is discharged next day, and within 1 to 2 weeks he is back to his foot, and by a month or 4 to 6 weeks he is back to his day-to-day routine activities. As I explained, if the ACL is torn, you have to operate. You take one of the tissue of your body, the most common, the part of hamstring muscles. You reconstruct it with the hamstring muscles and fix it with the bioabsorbable screws. The advantage is this, that the bioabsorbable screws dissolves in the body, and in the course of 2 to 3 months you don't have to remove it. See, post ACL reconstruction or anterior cruciate through the camera hole or the arthroscope, patients are made to walk next day with the knee brace. They are discharged on second to third day. By 2 weeks, we give them a small brace, we call hinge knee brace. Patients are allowed to sit on the chair and gradually go up and down the stairs. By 1 month, they are back to their day-to-day activity. But yes, driving car, we ask them after 6 to 8 weeks. Two-wheeler if they want to, 3 months. By 6 months, we encourage them to do running, jogging, treadmill and light sports like badminton, table tennis. And we train them gradually for next 6 to 8 months so that by the end of 1 year, they are back to their sports like football, cricket, dance, aerobics. The ligament tear is not the end of your sports career. The treatment of ligament injuries is to get back to sports and get back to what you love.